Hello, my name is Tori Whitacre Martonicz, and I'm the Senior Editor for Infection Control today. And today I'm here with some managers from Sage Memorial Hospital, which is in Ganado, Arizona. Welcome. Thank you very much.
Thank you.
Christian, would you mind introducing yourself?
Hi, my name is Christian BigWater, Public Relations and Marketing here with Sage Memorial Hospital. Good to be here.
And Tiyarra, would you introduce yourself, please?
Sure. Yate, my name is Tiyarra Wauneka, and I am the Environmental Service Supervisor here at Sage Memorial Hospital.
Thank you so much for coming. What I wanted to discuss was Sage Memorial's infection control and prevention practices. Can you tell me a little bit about the hospital, how large it is, and who you serve?
Yeah, here at Sage Memorial Hospital, we're located in Ganado, Arizona, and that's on the Navajo Nation. Primarily, we focus on our immediate community, which includes the chapters of Cornfields, Ganado, Kitlachi, Clagato, Greasewood, and Steamboat, Wide Ruins, and Nazlini. So we do welcome patients and visitors that are beyond our service area. So we do cater to both Navajo and non-Navajo. Just a little bit about the demographics of the people that we serve. And this is based off the community health needs assessment. Approximately 95% of the patients that come in here are of American Indian or Alaskan descent. So although I did mention we do service other people and they're welcome to come to the hospital, our primary visitors and patients are mainly Navajo.
What unique challenges do you have in the infection prevention and control space that maybe a hospital in Boston or Houston may not have?
So some of the challenges that we currently have with our infection control is that because our hospital is a private hospital, we do have surrounding facilities, healthcare facilities that are funded by IHS. And so being a private sector, we are faced with the challenge of ensuring that we get the proper training that we need to carry out the services that environmental services provides for our facility. Also, we are in a rural location, so a lot of times we don't have access to those resources. If you were in a bigger city where resources are nearby. So it takes time for us to receive supplies. And so I'm going to give the example of going into the pandemic. So when we went into the pandemic, a lot of the healthcare facilities that were located in a bigger city or in a bigger town had access firsthand to all the PPE supplies that they needed or any kind of disinfection solutions that they needed. But for our hospitals located on the reservation, it was really hard to get those supplies for not only our hospital, but for our community that we serve. And here on the reservation, the community that we serve, we have a wide spread of community members. So we don't have anything like street signs or streets with, houses that are clustered together. We spread across a big section of land where we're kind of just scattered here and there. So that was our biggest challenge, and is still our biggest challenge, is ensuring that we are able to get to all of those community members that we serve, and being able to find a reliable resource where we can get the things that we need for infection control, as far as our supplies. And sometimes it does take time for them to get it to us. So, for example, if you were down in the Phoenix area, they could get supplies within a day, overnight. But for us, it could take anywhere from a week to 3 months to receive those supplies. So we really have to plan ahead at least 3 months in advance to ensure that we constantly have the supplies that we need to take care of our community and our healthcare facility.
So you have everything all there in the hospital. You have sterile processing, environmental services, IPs. Do you have IPs on staff?
Yes, so we do have one IP that is currently with us, and then myself included. So myself, along with my team, we're pretty much the infection control and infection preventionist team that oversees our facility.